Assalamu alaikum. My name is Mohammad Nabil Ahmed, and the topic for my today's presentation is rational and irrational use of drug efavirenz. So, what is efavirenz? Efavirenz is an antiretroviral medication that is used to treat and prevent HIV and AIDS. It is generally recommended for use with other antivirals. If we talk about the rational use of efavirenz, it is a preferred NNRTI. It works by decreasing the amount of HIV in the blood and it is used along with other medications to treat HIV virus. Although efavirenz does not cure HIV, it may decrease your chance of developing acquired immunodeficiency syndrome and HIV-related illness such as in serious infections or cancer. The rational use of efavirenz consists of some adverse effects, mainly of CNS, that are dizziness, drowsiness, insomnia, nightmares, headaches. Some psychiatric symptoms that are observed by the patient who is being medicated efavirenz are depression, mania, psychosis. Efavirenz come in the form of tablets and in the form of capsule also. There are two variants of capsule. One is of 50 milligram and the other is of 200 milligram. While the tablet contains in the packaging of 600 milligram. Let's talk about drug interaction of efavirenz. It acts as an inducer and an inhibitor of cytochrome 3A4. Efavirenz induces its own metabolism and interacts with the metabolism of many other drugs. Efavirenz may lower methadone levels. Patients receiving these two agents concurrently should be monitored for signs of opioid withdrawal and should be in check. While if we give efavirenz along with darunavir, it will increase the serum level of darunavir. While if we give efavirenz along with Etravirine, nelfinavir, yeah, nevirapine, the serum level of these drugs will be decreased. The metabolism of acetaminophen can be decreased with combination with efavirenz. The risk or severity of QTC prolongation can be increased with efavirenz is combined with acetaminophen. Medication that can affect the removal of efavirenz from the body includes some drugs that are used in the seizures, such as carbamazepine, phenytoin, rifampicin, etc. Efavirenz is marketed in Pakistan under many brand names, but the most economical brands are Estiva, Efavir, and Xerenz. Now let's move towards the case study. The case study is a 47-year-old woman presented with chief complaint of fever 203 degrees Fahrenheit, usually at night, non-productive cough and dyspnea which has progressed over 1 week. She was tested HIV positive 5 years ago, at which time her CD4 lymphocyte count was 583. Zerovidine was started, but she stopped taking it after 1 month and did not return to her doctor for follow-up. She has anorexia and lost 70 pounds over the last 3 months. She used heroin and cocaine intravenously for a 6 month period last 6 years. She does not smoke or drink now. She has no past STDs and is not sexually active. She has no known drug allergies. Her physical examination concludes that she was pale, diaphoretic, and in acute respiratory disease. Her blood pressure was measured as 110 by 70. Oral thrush was present. Examination of the lungs disclosed poor inspiratory effort and bivascular crackles two-thirds the way up to the posterior lung field. She had a tachycardia but no murmurs. Her abdomen was non-tender. There was no enlargement of the liver or spleen. Pelvic exam was normal except for vaginal candidiasis. Neurologic examination was normal. So we are going to make SOAP notes. The main structure of notes include subjective, objective, assessment, and plan. So subjective includes the gender, that is female. Her age was 47 years. The chief complaint was fever, that is 103 degrees Fahrenheit, non-productive cough, and dyspnea. The duration of chief complaint was coming from last 1 week. Temporal, it occurs mainly at night, and the history includes that she was tested positive for HIV 5 years ago. In objective, we will write her blood pressure reading that was 110/70, CD4 lymphocyte site level that was 583 5 years ago, Basilar cracking that were two-thirds to the way up to the posterior lung field. Now she should perform CD4 lymphocyte test again in order to check the confirmation of presence of HIV virus. Antigen antibody test should also be done. Assessment. Since she had been diagnosed with HIV 5 years ago, she didn't continue the medication. It is likely that she is still suffering from HIV. Plan that I would recommend that initiate therapy for the HIV virus. Therapy includes NNRTIs and the most common one is Efavirenz. It is used along with the other medications of antiretroviral. The dose should be 600 milligram per oral daily, used in combination with protease inhibitor, either lopinavir or ritonavir. And for the treatment of bacillus crackers of lungs, inhaled steroids reduce airway inflammation, bronchodilators, and open. I have taken the references from Ketzen, Leppincott, some Google scholars, and the case study was taken from the website of NCBI Bookshelf. Thank you.